All right. Well, everyone, welcome. We still have some people joining, but the recording is my cue to get started. I'd like to welcome you all today for this Time to Act Mental Health Echo. I'm going to share my screen really quick. Is that sharing there okay? So just a reminder that these echo sessions are recorded. We record them for the purpose of review. For any of the participants who are here, and those who aren't can get on the Canvas website and see these recordings. So by participating in this session, you're consenting to be recorded. If you don't want to be recorded, or you don't wish to be recorded, go ahead and disconnect from the session at this time. Keep in mind that ECHO is an interactive participatory community where we try to communicate and support each other, trying to share our thoughts and our insights. This happens both in the didactic as well as in the case presentation. So we'd encourage you, if you have questions during the case presentation or during the didactic presentation, if you go ahead and just raise your hand, or at a break, you can put something in chat. And Ali has said that our presenter has said that she'd be happy to answer questions. We also do the case narratives toward the end of the session, where we discuss specific narrative cases that we would like to get some assistance on, and having some ideas on how to best address the problems. We'd encourage you, if you're sharing information, whether it be during a story you're sharing or during the case presentation, to remember to not utilize real names to de-identify people that you're talking about, because we do talk about some sensitive topics here. So just make sure that you de-identify any information that you might be sharing. Keeping in mind the three parts of the echo session. The first is that we have a didactic speaker. Today will be Crandall from Brigham Young University. I'll let her introduce herself in a minute. After the didactic speaker and the questions, we'll have a case presentation. And then one of the main things we do this for is to build that community of practice, so that as professionals, as providers, as families, we can work together to best solve some of the issues that come up as we go through these echo sessions. Just remind you that if you are on, we'd encourage you to have your camera on. Those of you who are on the hub team, we'd ask you to go ahead and identify yourself with an asterisk, either before or after your name, so that those on the session will know who those hub members are if they need to reach out or have questions to ask. I think we probably all know how to rename our profile. If not, feel free to send me a chat and I'll help you be able to do that. Raising the hand feature, obviously, you can utilize the little icon. You can put something into chat, or you can wait for a break and we'll answer any questions you might have. Always keep in mind also that you can pre-register for the echo session. The time to act at aggies.usu.edu is where you would go to pre-register. That'll get you the weekly announcement and links to the Zoom session, as well as will allow us to get you the information you need to be able to participate in the Canvas learning management system that we utilize for these time to act and other echoes. To get credit for attendance, we don't do formal continuing education units or continuing education credit, but many of the professional organizations will honor a certificate. So to get credit, you fill out the survey that Shana will populate in the chat multiple times throughout the session. Once you've filled out that survey, you'll have a certificate of attendance sent to you. If you do pre-register, that expedites the receiving that certificate of credit. As I mentioned, we do utilize the Canvas learning management system, where we put our videos, we put the slides from the presenters, we put recommendations that come out of those case studies and many other things. There is a discussion board on Canvas that sometimes people will get on and share a thought or a question. Again, building that community of practice is one of the main focuses and main purposes of the echo sessions. So always keep in mind that Canvas is available. To access that, you just need to send again an email to timetoact@aggies.usu.edu, and we'll give you instructions on how to register for that Canvas page. These case studies or case presentations are critical to this. It's where we take what we learned in the didactic session or what we've learned in our education or experience, and we're able to put it to use. Where the rubber hits the road is what I like to say. A lot of times we have the best feedback come out of those case presentations that are really beneficial to the presenters or to the professionals that are sending those in to us. Keeping in mind, we'd like you to share information about real situations, and it doesn't have to be about the exact topic of the day. So it can be about anything, and we're always happy to have people share those. If you'd like to do that, again, hit that email, timetoact@aggies.usu.edu. It's a great opportunity to be able to learn information if you have a difficult case that you're stumped on. We typically have 30, 40 people on here that have a variety of experiences that can help with some of those questions you might have. These are the ways that you can follow. I'll leave that up for just a quick second. You can follow the Institute for Disability Research Policy and Practice, the ECHO sessions, on social media. We do have a variety of ECHO sessions that we do. This is the mental health across the lifespan ECHO session, but we do have platforms on Facebook, Instagram, and LinkedIn. And with that, just a reminder, the next session will be March 20th. That's always the third Wednesday of the month at 12 o'clock. So without any further ado, we'll go ahead and introduce you to Ali Crandall, who is an employee at BYU down south. And even though we're up at Utah State, we have a love for BYU too. We both won our basketball games, so we don't have to have conflict today. So Ali, if you go ahead and introduce yourself and go ahead and take your time, whatever you need.
Thank you, Kurt. Yes, so I'm Ali Crandall. I'm a associate professor of public health at BYU and have been here since 2015. Before I did my PhD, I worked for several years in the field, mostly in international or global settings, but also mostly on the West and East Coast. So I know a little bit about the practice arm, though everybody's doing different things, but what you're doing is where the real work happens. And I guess in academia, we're just hoping to give a little bit of information that will be helpful for you. So I study the family and how families influence our health. And I in particular look at mental health. And a few years back, as we were looking at families and health, we were looking more closely at the research on adverse childhood experiences and their influence on health. And we were a little bit bothered that it was so negatively skewed. We thought, well, what about the positive childhood experiences and what role do they play? So I'm going to talk about that research today on the childhood, mostly the childhood, but I'm also going to talk a little bit about adulthood and some recent research we've been publishing as well on positive adult experiences. So I have two screens up. So when I turn this way, I'm often looking to see if anything's coming through on the chat, and I'll try to be just really interactive with it. So as you have questions as we go along, I will try to answer those. And if I miss something, I'm okay if somebody interrupts with voice and says, hey, there's a question about this. And then I'll happy to answer questions at the end as well. So I'm going to go ahead and share my screen. Okay, so I know you're focused a lot on mental health. So fortunately, that's what my research looks at most of all. And so we'll talk about what ACEs and positive childhood experiences are. I know some of you that might be a review, but for those where it's new, I do want to do a quick overview. We'll talk about some studies that we've done on it, and then I'll introduce the positive adult experiences, and then a little bit on some resources that are available for what we can do. So those of you who may not be familiar with ACEs, they stand for Adverse Childhood Experiences, and what they are is it's basically this number score where we add up the number of potentially traumatic experiences that happened to you before the age of 18. And these are typically in the areas of abuse, neglect, and household dysfunction. There's a variety of ACEs tools out there. They're readily available online. Centers for Disease Control and Prevention has a measure that's typically used, for example, in the SHARP study and other places. Now, ACEs don't measure all sources of adversity. There's no way for us to measure that, but what we're trying to get through the ACEs score is to see people's accumulation of trauma or potentially traumatic experiences, rather than looking at, well, what experience is the most traumatic? It's looking at how does the accumulation of trauma affect us. ACEs are really common. This data is from the Centers for Disease Control and Prevention's ACEs study. And what they found was basically that most of us, about 2/3 of us, have experienced at least one ACE. So in their study, 36% of the population had experienced 0, and the rest had more. And we're usually more concerned as people approach 3 or 4 ACEs. That tends to be associated with the worst outcomes, which I will show you in a minute. I've had other studies, these are not as robust of samples as the CDC's, but that have shown even higher percentages of people who have experienced ACEs. And if you are working in a lower income population, chances are that you have maybe close to 100% that have experienced ACEs and a very high percent of your population that has experienced 4 or more. Well, it's always this question, well, why are these traumatic experiences in childhood leading to more mental health problems and other problems throughout life, both in childhood, but also throughout adulthood? And there's several explanations for this, but one of those has to do with the brain. And the slowest part of the brain to develop is the prefrontal cortex. That's the part of the brain right behind your forehead. And that part of the brain houses your self-regulation, your executive functioning capacities. So your ability to plan and pay attention and set and meet your goals, working memory, problem solving, and so forth. Those are all executive functions. And because the prefrontal cortex primarily houses these skills, but it's slow to develop. And so your environment can really then impact that part of the brain and then these capacities that we have. So that's one mechanism through which these potentially traumatic experiences could have this lifelong harm, is because what they do to the structure and function of the brain, particularly these really these sensitive periods of development that happen particularly in early childhood and in adolescence, but they're also happening in middle childhood and different times. And there's no way for us, we're all different a little bit in our brain development. So we can't say, well, it's at this age specifically where we don't want these things to happen. It's a little different for each person. Let me give you just some visual examples of the impact of ACEs on some different health issues. So we'll start with suicide. And these different bubbles here represent different health issues. And the bigger the bubble, the more people that are affected by that issue. So if you have 1 ACE, then it doubles your risk of attempting suicide during your lifetime. Versus if you have 4 or more ACEs, then you're 12 times more likely to ever attempt suicide compared to somebody with 0 ACEs. So it's pretty profound effect. And we'll look at a more physical indicator of bronchitis. And with 1 ACE, it increases your risk of chronic bronchitis by 60%. And with 4 or more ACEs, you're 4 times more likely to experience chronic bronchitis. And then looking at some substance abuse, people with 4 or more ACEs are 7 times more likely to consider themselves alcoholic and 5 times more likely to have used illicit drugs compared to those with 0 ACEs. So it's affecting us in different health behaviors, different health outcomes, and it's something we really want to pay attention to. But this is a pretty kind of negative outlook on it. If we just look at the negative things and what they're doing, are there things in childhood that can improve health? And that's where we looked at the positive childhood experiences, wanting to know if they help, if the more positive experiences a child or person has in childhood, will it reduce the impact that ACEs have, or at least sort of counter it? And so that's what we were trying to look at. So just to give you a little sense of where we're going with PCEs. So all of us need different ingredients, you could say, for our healthy development. And I love this analogy that somebody shared with me a few years ago. If you take a seed, maybe you're trying to grow a bean or a pumpkin or whatever it is. If you give that seed, you plant it, you give it adequate soil and water and sunshine, it's going to grow according to basically the genetic potential of that seed. If you add on some fertilizer and other things, it may even do a little better than expected. But it doesn't matter how good that seed is, if you're not providing it the basic soil or water that it needs, then it won't grow up to its potential. And as humans, we're similar. But our sort of ingredients are, we need good nurturing in our lives, we need stability, and we need structure. And so that's what these PCEs are more or less designed to kind of measure. And PCEs, so when I say PCE, that stands for positive childhood experiences. Sometimes we'll call them counter ACEs, if we're using the acronym of advantageous childhood experiences, which also is an ACE, so an ACE that counters the other ACE, or benevolent childhood experiences, BCEs. These are all basically the same thing. There's a couple really well-known scales, the benevolent childhood experiences scale and the positive childhood experiences. But again, like ACEs, these are a cumulative measure, in this case, of advantageous experiences. So here is the scale created by Angela Narion and colleagues. This is the benevolent childhood experiences scale that we often use. And if you scan through these items, you'll see a lot of them have to do with healthy relationships. So feeling safe with at least one caregiver, having at least one good friend. Do you have beliefs that give you comfort? Those doesn't necessarily have to be religious beliefs, but you could also look at this as a positive relationship with a higher power. There's in here liking school, having a teacher who cared about you, having good neighbors. Is there a parent, if there was an adult who's not a parent, who's not your parent, that you could also look to for advice. And then these last things are opportunities to have a good time, sort of a positive relationship with yourself, and then having predictable routines. And the other scales are similar to this one. We'll sometimes combine these 10 items with a few items from a different scale to make sure we're covering everything. But what I found is that it doesn't necessarily matter so much. It's more, are we able to basically measure this cumulative measure of positivity in childhood? So looking at that led us to our first study where we wanted to examine how PCEs affected adult physical and mental health. Myself and Carl Hansen and Brianna Magnuson, if any of you know them, we're jointly interested in this, and we have a little bit more interest in mental health, but we did include some physical health indicators. So we hypothesized that these positive experiences in childhood would be predictive of more positive behaviors and protect against adverse outcomes, even when ACEs were present. And we had a sample. I'm going to give you now some slides that have a lot of numbers. I am going to walk you through them. So there will be some numbers I don't even go through, but for those of you who like numbers, you can look at them. Those of you who don't like numbers, you can just listen to me or whatever, but I'm going to explain what we have here. So in this study, we recruited these adults from across the United States. There was 246 of them, and they had on average 2.7 ACEs. So quite a few ACEs, and 74%, so 3/4 of this population had at least one ACE. And then on average, out of the 10 PCEs that we were measuring, they reported an average of 8. So reporting quite high positivity, even though they'd also experienced quite a few ACEs on average in this population. Now, we know that people tend to over-report positive things. We call this a social desirability bias, and under-report sort of the negative. And so maybe this 8 out of 10, maybe it's inflated, but maybe this is the reality that people are in general experiencing a lot of good things in childhood. And if so, that's great. That's what we want to see, and we want to see it even go higher. And I should mention that 40% reported having all 10 of these PCEs. So here's a table here. And again, don't turn off because there's a lot of numbers. But basically, if there's an asterisk by the number, that means it's statistically significant. So we feel reasonably confident with those results. So first of all, we looked at how were ACEs that happened in childhood, how are they affecting your current health? And what we found was that ACEs were associated with more sleep difficulties, higher odds of having ever smoked daily, more stress and more depression, and less executive functioning, less internal locus of control. That's your ability or your belief that you have control over events in your life rather than external circumstances having more control. And ACEs also were associated with less gratitude, forgiveness, and closeness of your family in adulthood. Some of these effects were large, some quite small, but this was just looking at ACEs on adult health without accounting for the positive childhood experiences. Once we accounted for the PCEs, and we also adjusted for different demographic factors like age and gender. So this column right here is the adjusted. So this means we are accounting for positive childhood experiences now. What you'll find is some relationships that were significant before are no longer significant. And for the most part, the size of the coefficient, so the number got smaller. So the ACEs were still associated with smoking and stress and depression, but the impact on mental health was less once we took into account the PCEs. Whereas with PCEs, they were associated with almost everything in a positive way. So you have a better diet, better mental health, fewer mental health problems. And this relationship held true even when we included ACEs in the model. So irrespective of your ACEs score, if you had, for each increase you had in positive childhood experiences, it improved your health. And that was particularly strong with mental health. We're also curious, so what about if somebody hasn't experienced any ACEs? Do the positive childhood experiences matter still? So it is possible that you could have 0 ACEs or low, maybe 1, and also have a low positive childhood experiences score. So typically they are pretty highly correlated. So the more ACEs you have, the fewer PCEs and vice versa, but not everyone. And in this case, we had 64 people who reported that they had no ACEs. And so we looked at, well, what's the impact of these positive childhood experiences on health, even when you've had no ACEs? And what we found is that it had an impact on your adult body mass index, your executive functioning, locus of control, stress, depression, gratitude, and forgiveness. And so the more PCEs, the better off you were for each of these. So it led us, as we looked at this data even further, our conclusions were that as concerning as ACEs are, it may be even more concerning if you don't have PCEs, that the lack of these positive experiences in childhood may be more detrimental to your health in adulthood than the presence of ACEs. Likewise, if you have these PCEs, then you can work through all these different challenges in life. And I think this may be in part that we all go through ups and downs in life, and we need positive experience. We need this nurturing stability and structure. And when we have that, it helps us to kind of work through these various challenges. But when we don't, it hurts our coping and the development of resilience in our lives. And we've seen this in other studies. We had a study where we looked at alcohol and tobacco use in adolescents and found that PCEs help to prevent initiation of alcohol and tobacco use, and particularly its later use in adolescence. In young adulthood, we found that PCEs were protective against mental illness. And we've also done this study in a low-income community here in Utah, in the Provo area, and we found similar results as we found in these nationwide studies. And even when adversity has been repeated and prolonged, PCEs, we've found that they still help. And time again, it seems that PCEs are particularly important for mental health. So they matter for physical health too, but it's particularly with the mental health area that they're so beneficial to us. And we've also seen that they're associated with improved health of the family. One of the things I do still see, it's not like ACEs don't matter at all. They do. And I have found in multiple studies that even as we account for PCs, they are increasing the risk for substance use and suicide. But the PCs help to counter that or balance it out. So PCs matter regardless of your income level. They help even if you've experienced repeated or persistent ACEs. And again, they're particularly helpful at preventing mental health problems and lead to healthier families. Now, this leads to sort of the next question. As I've talked about this with different people around the state of Utah and throughout the country, a question I repeatedly get is, well, what about in adults? So I could look at these positive childhood experiences and I could try to help children to have more of those. Like we can each be, so to speak, we can each be a counter ACE in our own way and trying to develop healthy relationships with the children in our lives. But what can we do to help the adults who are caring for the children? Can these same positive experiences in adulthood help? Or does it no longer matter because once we reach age 25 or 30, our brain has reached maturation? So we created a scale that we called the positive adult experiences, and you'll see that several of these items look similar to the PCE items. And there's 15 of these items. And I have given these slides to Janelle. So hopefully they are widely available to you, and so you can look these up. But these questions have to do with, have you been able to talk to people within and outside of your family about your feelings in the last 2 weeks? Do you feel that your family stands by you during difficult times? Do you enjoy participating in community events and traditions? Do you feel like you belong in your community? Do you feel supported by your friends? Do you feel like you have a close and lasting relationship where you can depend on the person to help you make decisions about your life? Do you feel safe in your home, in your neighborhood? Do you have good neighbors? And do you have beliefs that give you comfort? Have you done something fun in the past 2 weeks? And have you done something to take care of yourself, such as reading a book or getting a massage or exercising? Do you have a predictable home routine? And are you engaged in daily activities that are meaningful to you? Those are, and again, there's lots of other PAEs that I'm sure we could together come up with. How we developed this is we first of all looked at the PCE measure to see, hey, are these different items applicable in adulthood? We went to the literature to see, well, what other things is it showing that are associated with health? So we added those in, and then we piloted the scale with various adults to make sure the items made sense and if there were other things that they recommended that we added. It's not a perfect scale. We're continuing to refine these types of things, and if you have suggestions, please send those my way. But in this study, we came up with this scale during COVID, and so we first collected data on it in September of 2021. So that's a year and a half into COVID in the United States. And I have this line here saying manuscripts in preparation. I forgot to delete that. There's a couple of manuscripts listed at the bottom of this slide. I know they're small, but in case you want to look them up, they are publicly available. So you don't have to have a subscription to access them. And this sample is a little bigger sample. We had 435 adults who are 18 to 56 years old who lived in the US, and about 1/3 of them had very high ACEs, and half of them, in this case, we used a 13-item measure of PCEs, and about half of them had 12 or 13 of those items. So they're reporting pretty high ACEs and also really high positive experiences in childhood. And then with the adult experiences, they reported on average 12.5 out of 15 positive adult experiences. And this data is collected during COVID, and so we saw elevated rates of depression and anxiety. 40% of the sample had experienced moderate to severe anxiety or depression in the past 2 weeks. I'm starting to see that number come down in some of our surveys, but there's still an impact of COVID on our mental health. So this time, rather than showing you a bunch of numbers, I'm just going to summarize what we've looked at is if you had either high ACEs or low PCEs, could PAEs make a difference or sort of be this turning point, as Michael Rutter would call it, a turning point in your life to better health? And that's what we did find, that if you had high ACEs, ACEs were associated with more depression and anxiety. If you also reported more PAEs in your life, then that helped reduce your odds for depression or anxiety. And similarly, if you had low PCEs, we found that, and low PCEs was associated with more depression and anxiety. But once we accounted for PAEs, these PAEs still made a difference. So it's, I think, better if we can get all children having more PCEs. And of course, we want to eradicate abuse and neglect. But these PAEs, they may be a second chance for us. And as we work with adults, a lot of times, even if we're working with children, we need to do something to help their parents and their caregivers. The PAEs are a second chance for them that may then better enable them to help their own children and create stronger communities. So even during a global pandemic, these high PAEs can reduce mental health problems for people who didn't have maybe the optimal childhood that we would have wished for them. So one of the take-home points here is that we can support adults to engage in and have different positive experiences. And sometimes what I'll do is recommend that people pick one PAE to work on and try to improve that, and then maybe add on more. But if we can help adults just to build a sense of purpose and meaning and healthy relationships and belonging with their families, neighborhoods, and communities, that seems like it can go a long ways to improving mental health. So pause here before I go on to see anybody have any questions so far. I haven't seen anything come up on the chat yet. Okay, well, I will jump into then some interventions and resources that are out there. So there's no, I guess, silver bullet that solves everything, but there are some tools that have been created. One of those is the CDC's Essentials for Childhood framework, of which Utah is one of the pilot states for it. I think it got interrupted a little bit during COVID, and I forgot to look if there was any updates as of this year, but when I last looked, there hadn't been any updates yet. But the Essentials for Childhood framework is really essentially aware of this need for positive experiences, that we don't just focus on the trauma, and preventing that, as important as that is. Often our way to address and eradicate ACEs is through these positive experiences. So it provides some strategies to promote relationships and environments that can help create these healthy neighborhoods and communities to help children thrive. And so you see here, they have 4 goals: to raise awareness and commitment, to make data-informed actions and decisions, and then create the context for healthy children and families through policies and programs. And I've included a link to their handbook there. And maybe some of you are working on this as part of this pilot. If you're more on the healthcare side, the American Academy of Pediatrics has created this handbook called Bright Futures, and it has guidelines for health supervision of children, so infants, children, and adolescents. And it has within it some themes for promoting family support and community protective factors. We need that. We need more of that in our medical environment. And then there's this framework called HOPE, and HOPE stands for Health Outcomes of Positive Experiences. And it emphasizes the importance of positive relationships to foster resilience. And specifically, they want to build supportive relationships, helping people to live in safe, stable environments and having good social interactions and developing social and emotional skills. And they have found so far that that's effective at both preventing ACEs and also treating the effects of it. And I'm just looking at this comment from Victoria that it makes you think that what grandparents went through a lot of ACEs during the Great Depression and World War II, and yet still came out with positive adult attitudes, resilience, and family first outlooks. Absolutely, Victoria, that as traumatic as that time was, and we can even say as traumatic for some people as COVID was, and these different wars and different things happening, that if we can build in these PCEs and really try to pull on those positive, that can help us to weather the storms of these challenging worldwide events. And just a little bit more on some results of HOPE. They found higher child resilience when the child and their parents discussed things that mattered, when the parents participated in the child's activities and knew their friends, and when the parents managed their own stress around parenting. So some of these kind of get at providing the children with positive experiences, but also the parents managing their own stress around parenting is really kind of a PAE, like as parents, to be able to provide the environment we want for their children, they need support as well. And HOPE is finding good results even when children had experienced 4 or more ACEs. And so positive experiences were particularly protective when these included feeling like your family stood by you in hard times. So going to Victoria's example, is you're going through these traumatic experiences, whether it's the depression, a war, losing a job, a pandemic, whatever it is, if you know your family stands by you and you have someone to talk to about difficult feelings with, that can be really helpful. And I will say we have a measure of family health as well. I haven't included that data in these slides, but one of the things I found during COVID was that these healthy family relationships and just healthy families in general, that was maybe one of the most important things for mental health during COVID and beyond. But we saw that coming out even more so than what had happened in childhood. And adults who had 3 or more ACEs, but if they also had positive childhood experiences, they had lower rates of smoking, obesity, depression, and poor health. So I will kind of wrap this up by saying we're particularly new on the research on positive adult experiences in mental health and other health outcomes. And we haven't yet done a study specifically in a lower income community. So if you are interested in this work and think, hey, my population that I'm working with, I'd love to do some research in this area, we like to partner with agencies. So our initial study, we partnered with United Way of Utah County on the Positive Childhood Experiences study. And so if you have an adult sample that is, especially if it's lower income or otherwise underserved, we'd love to look at how PAEs are affecting health and well-being in those samples. So if that's of interest to you, please contact me as well. And perhaps there's some research that we can do. But I'll wrap up what I have to say there, and I'm happy to answer questions that come up if you want to put them in the chat, or use your unmute and talk. Either way would be great. And I'll stop my share so I can see you.
Dr. Crandall, while we're waiting for people to garner the courage to ask you a question, thank you for this information. It's wonderful information. If any of you have questions, I think Dr. Crandall is a great resource. I believe in that last slide, and for those who will access that on Canvas, there's an underscore between Allie and Crandall, isn't there? So Allie _ Crandall.
Yes, I can type that into the chat.
Yeah, if you just throw that in the chat, that would be great. Anyone with any questions for Dr. Crandall?
it seems like having some data on for families who have been in early intervention or the parent-to-parent programs, those programs that are focus on the very first events in life from babies, up to 3 and then to 5, studying parents, the pre and post of that experience, and hopefully showing how they felt more positive, had more positive experiences to counter the ACEs. If we could show that these early programs had that effect, they would be wonderful with the legislature in showing this aspect of countering ACEs and building health, mental health and physical health at a very early age within the family context. And for those babies that arrive afterwards, after early intervention, for a healthier system, family system.
For sure, I agree. Like, we need good evaluation data of these different programs. I think that can be so helpful, particularly as we show how it counters trauma. And these different things these different resources I showed you, they're still in the early stages of sort of the evaluation of them. And so we need to know more. What's the solution? Like, we can say, these are the PCEs, these are the ACEs, but what do we do to help families have more PCEs and more PAEs and whatnot? I agree, Susan. I think that's important. I'm seeing a couple questions in the chat here. So Cherie says, if people grew up with high ACEs, what is the best type of help to get them? Is there a specific therapy, anything to help them overcome? I think it's going to vary from person to person and experience to experience. I do think we need to focus more on the positive as a way to help overcome the negative. And so one of the things I'll sometimes suggest is taking out, this 10-item, 13-item PCE questionnaire and saying, well, how many of these did you have? And sometimes just the process of talking through the positive things can be helpful. But I'm not a therapist, so I don't want to say what's the right therapy and what are the things that work. I look more at the population level, and we're still figuring that out. So I think there's still more that needs to be done there. As regards to more studies relating to the PCEs and the PAEs, I can send you articles. I think I have in the slides some citations for articles you can look up, but if you're not able to access them, let me know. And some of those studies I referenced, I didn't put all of the references on there. So if you want them, please shoot me an email and I can send you a list of citations, and then any you can't access, I can help you get access to them. So Audrey says she agrees with Susan. Expressed her thoughts. It would be wonderful to have supportive evidence for the programs which support and teach PCEs. Yes, and would love to dialogue with any of you where we might look at doing potential evaluations of that. And do I have Latino population data of PCEs? As a question from Carolina. I don't. We did in the study that we did in Provo, it was a high percentage of that population. I can't remember what percent were Hispanic or Latino. And we saw similar, if I remember right, we saw pretty similar rates on ACEs and PCEs as with other populations. But again, that's an area like looking at different groups, not just by income, but by race, by culture, nationality. I have seen some studies conducted in other countries as well. And it just seems to be this repeated theme. PCs really matter. And then again, with the PAEs, we can assume that they matter, but we don't have as much data that way.
Looks like there's one more question, Dr. Crandall. How does concept of resilience come into play? That's Wendy Byron.
Oh, thank you. I missed that one. So that's a great question. We use the resilience theory for our study. And so people talk about resilience in different ways. I guess I'll talk about resiliency theory kind of has these three different models. One of them is this compensatory factors model that says even as you have challenging experiences, we could use the ACEs there, and they have a negative impact on you. If you have some positive things countering it, they'll also have a direct effect in the other way. And so that's how we kind of have found most of our studies have followed this compensatory model where both ACEs and PCs have a direct effect on health, but that the PCs is stronger and in a positive direction, even when there's ACEs. There's also this protective factors model that says the more PCEs that you have, that it will reduce the strength of the relationship between ACEs and poor health. Some study, it's very similar to the compensatory model. Maybe it's an academics thing, but we have a little bit less evidence for that. Some studies that's showing up and some it's not. And then there's this challenge model of resiliency theory that says, hey, we actually need challenges in our life. That challenge helps us to grow and develop. The problem is when a child or an adult has too much challenge, that it's overwhelming. But if we didn't have any challenge, that would be harmful. So ACEs, there's some ACEs, parents divorce, parents have mental health problems. These are really common. And other ACEs that are fortunately a little bit less common, such as sexual abuse, though it's still way too high for where we'd like it. And I can't say that sexual abuse is ever going to be a good thing at all, but challenge in our life in general can be a positive thing as long as it's not too much. And that's where when somebody has an ACE score of 4 or higher, that's probably too much challenge that's happening in their childhood. Though there are some children who may just have one ACE, but that could be a particularly terrible experience for them. They're not all created equal. So those are sort of these three models of resilience that we've looked at, and some we've been able to test a little bit more than others. So I would imagine that PCEs help us on this sort of path and this process of becoming more resilient over time or developing it. Okay, and then Lois has okay, I am not, is hand HS, is that hand health start? And this may be a question for everybody on there. If you're aware of anyone who shares this interest, she's trying to mobilize interest in the call-up program using primary care physicians as a consult and has her email there.
Perfect, thank you. Are there any other questions, Dr. Crandall? Thank you for your questions so far. If there's no other questions, Dr. Crandall, thanks so much. It's a pleasure getting to meet you and to know you, and thank you for sharing your expertise with us today. It's really interesting. I enjoy these echoes. I'm a physical therapist by profession. I don't have much training, if any, in mental health areas, but enjoy listening to the content that you shared today, and really love the idea of those positive childhood experiences kind of being that anti-venom, so to speak, for all those ACEs that are so common in the world today. So thank you for your input. Anyone on the call, I hope it's okay to say, feel free to reach out to Dr. Crandall if any questions come up, or if you'd like to collaborate with some research with her with those populations she's looking for, with the adults or underserved populations. With that, Dr. Crandall, you're welcome to stay on the call for the case presentation. If you need to go, we totally understand, just appreciate what you've done. So thank you for your time.
I do need to run, but thank you so much. And again, email me if you have questions, thoughts, or want access to those links.
Thank you.
Much. All right, so thank Dr. Crandall for a presentation. It was a great presentation. We do have our case presentation now. Stephanie Anderson is going to be presenting this. She's from Help Me Grow Utah, I believe. So Stephanie, I'm going to let you go ahead and introduce. Following the introduction of the case, what we're going to do is we're going to separate into different breakout rooms I'm gonna let Shayna, once we get through the case, identify the leaders of those rooms and put people in rooms, and then we'll spend a few minutes in those rooms. Again, the purpose of this is to answer questions that might have been brought up in the case presentation, utilize your collective knowledge and experience to be able to help find solutions for the issues that Stephanie will bring up. So Stephanie, if you're out there in Zoom world, go ahead and unmute and hop on.
Okay, I am. And I'm going to read this because I will talk too much, but I do want to mention that Dr. Crandall did do some of her very first studies at the South Franklin Community Center where this case study happened. So I was really interested and tried to bring it into focus, maybe align with that. But this was one of the hardest cases that I experienced at the community center when I was there. And so I know that experiences repeat themselves. And so I'm hoping that I can get a lot of help from those of you in this field. So I'm just going to read what I wrote. If you have questions, I can answer them, but I tried to be as general as possible, but giving you as much information. So we had a 6-year-old boy attending a basic music class at the community center, and the volunteer instructor told the staff that she didn't feel that the boy had the self-regulation to participate in the class. He was disrupted, did not follow simple instructions, and with most of our participants, he spoke limited English, even though we do have translators. The staff explained that he was new to the United States and therefore we would have an intern join the class to support the boy. In the next class, he was not as disruptive, but withdrew and not participate. And when the intern tried to talk to him, he said how much he hated the United States and his new home. He wanted his grandma that was back in his native country, and he wanted to go to heaven. And this was a really red flag for our intern. And so our intern very quickly turned to the staff, and we called to meet with the parents to talk over this situation. And when the parents arrived, the mother was so distraught that she was crying so hard that she could not speak at all. And she assumed that her child would be kicked out of the community center and school for his behavior. And when we reassured her that that was not the case, but we wanted to work together to help this boy and help him feel safe and comfortable in his new surroundings. And at this point, the father told us a little bit about their history, that they had come to the United States on his wife's student visa, and she was attending school full time. And unfortunately, they had been scammed out of all of their life savings by a church member in their native country that guaranteed that she could get the father a work visa. And of course, they found out when they arrived in the United States that that was not available. He was trying to find work, but was scared about getting caught if he worked and how that would separate the family. And at the same time that that was happening, they were being evicted from their apartment because they were 2 months behind in rent. And the boy was very close to his grandmother and missed her, and that was a relationship that was really hard for him. And he felt he was the reason why his mom always cried and was almost the problem in her family. And he also had been told that heaven was such a good, peaceful place. So his reference for wanting to be there was so he thought it would be in a better place than he was. And the couple had gone to their religious leaders and asked for help and was told no. So that is the case study that I have to present to you today.
Okay, there we got it unmuted. Thank you, Stephanie. That sounds like a whole lot of bad things happening all at once to this poor little family and their kid. Any questions anyone has for Stephanie about the case? Anything that you'd like clarification on that she might be able to identify? And we'll bounce Stephanie through the different breakout rooms so that she's able to answer questions if you don't think of them now. But any questions
How
for
long
Stephanie?
was this period of time?
Pardon, Susan, I didn't hear what you said.
How long was this period of time from the first moment when he was so dysregulated, then went to wanting to go to heaven? What was that period of time? Was it a couple of months or a few months or?
The volunteer and most of the people that work at our community center or offer programmings are volunteers that aren't trained in
Yeah.
child development. So those classes started in September, and it was in about 3 weeks that she came to the intern and said that she wanted this child removed. She had self-diagnosed him of having ADD. And so that's when we said, well, that's our policy, is that we'll put someone with him to work one-on-one. So we found out 3 weeks after the classes started. I would assume because the parents had just moved here to start school, that they had moved here in August or September. So I'm not quite sure how they were behind in rent that much already, but
Yeah.
that's
Okay.
what they said.
Just
Okay, and-
wondering how much attachment there was to that place they lived.
It was their home, and he was in second, I want to say second or third grade.
Okay, thank you.
And Stephanie, there's also another question in chat. Jessica's asking if they had other children as well.
No, he was an only child.
Any other questions from anyone? Clarification of that? Okay, so there are some questions that we want to have answered.
Hey,
Oh,
Heather, did you have a question?
I did. You said the mom had a student visa. Was she just attending school or was she working at all?
No, she was not working, and that was one of the recommendations that we had said, as with her student visa, that she could work. And that was something that we're looking into, although her focus of school was very difficult, but it was one of the options that we let her know about, and we did. She was going to UVU, and so we actually connected her with the student support center there, so we were able to connect her with that.
And one more question, Stephanie. Are any supportive connections to the community?
No, nope. They came here just to go to school, and fortunately, they did found the community center. But their one connection was to their religious affiliation, but it had been a negative experience. But they were still continuing to attend that church, but they weren't getting any kind of support.
And sorry, Stephanie, one more question that I had. Did they have any family
No,
for their reason for coming to this area, or
no.
there wasn't
They
any particular,
came
just school
specifically
brought 'em here?
for the mom to further her education.
Okay.
And they were not in their 20s. They were older parents, but you could tell they cared very much for their child.
And JC's put in the chat also, there are different resources depending on the country of origin. Can you share that without violating confidentiality?
They were from Brazil.
So, okay. Okay, I think we're gonna put you in some different rooms. I'm gonna let Shayna take the mic here for a minute and identify the rooms. But there are some questions in the chat. The first one for Heather's group, or for JC and Rebecca, where could the family go for assistance? It says this Catholic Center in Salt Lake City helped this family, but are there other places? Is that where this family lives? Is it in the Salt Lake area somewhere?
No,
okay.
we are in Utah County, and
Okay.
that was I was the one that actually helped this family. It was just so overwhelming to me, and the only place at that time, and this was pre-COVID, was the Catholic Center was the only place that had any housing resources. There was nothing in Utah County that we could find because of the father status, and that the mom was here for I was surprised how limited it was. And the Catholic Center, and I'm probably saying the name incorrectly, and I apologize for that. But they were so willing to work with this family where I couldn't find any other support for housing.
Okay. Before we go on to the next question, Haley's got her hand up. Sorry, Haley. So JC and Rebecca, your group will talk about rent or housing assistance might be possible. Heather, where you would recommend the boy goes for support, what kind of support they can get. And then Jen's group will have, how can the father work? Is there any way to get him to be able to work? Okay. And then Haley says, what year did this happen? So you said it was pre-COVID.
I am really sorry, but it was like a year before, like it was right when, so COVID happened in March, right? Of what?
2020.
So it was that August, that fall of pre-COVID.
Pre-COVID. Okay, so 2019. Perfect.
Yeah.
All right, so we'll go ahead and put you in the different rooms, Heather, JC, and Jen, and Rebecca, if you'll help facilitate those, and then make sure you've got a scribe to be able to take notes, and we'll come back together at about 15 minutes. Looks like all the groups are back. We've got JC and Jen and Heather all back. So hope you had a good discussion there in the case presentation. We've got about 2 or 3 minutes per group. Maybe share a thought or two you had about the question that we asked. If you'd state your question that you mainly focused on so we know what the resources are. And then just a reminder to send all of those resources to the email that Shana will put in the chat so we collect those and put them in our Canvas page. So let's start with Heather. You want to share, or whoever took notes and wants to be the spokesperson for your sharing?
All right. So we talked about it would.
Oh, I think you accidentally hit your mute, Heather.
Thank you. We talked about it would be really beneficial if either somebody at the community center or somebody who's working with the family took the time to get to know the little boy a little bit more, find out what his likes and interests were, maybe even do a home visit, something that would give them an opportunity to let him get into his world and what he enjoyed, maybe help provide a picture of grandma so he could have that connection, and also help the family build connections, build their resources, develop relationships. It was also suggested that the Brazilian community was expanding and building within this area, and so they may be able to help them connect with that and participate by accessing through Facebook or advertisements around the community or the school. Also helping the family to build different types of activities that they could do together so that they feel connected, going to the library for story time, participating in different ways that they can connect in different community events, things like that. And then also, last of all, helping him to find a way to connect to grandma, maybe through letters or email, things like that. So.
Great. Thank you, Heather. I know up here in Cache Valley, there's it's a Portuguese speaking Facebook group, but mainly Brazilians. My daughters have done that in school and have been connected with that group. And they are really Brazilians, at least our experience has been, are very community oriented folks. So I like that idea.
And we did have somebody who had some fantastic resources for homelessness. And so I'll include those in the email resources that I sent afterwards. So
thank you, Heather. Appreciate it. JC, why don't we have you go next?
Yeah, thanks, Kurt. So we were at work with the family go for rent assistance. The Catholic Center in Salt Lake City had helped the family previously. Lots of questions about the situation of the family because there's lots of statuses involved. There's some refugee resources, but because she's here on a student visa, she might not be considered a refugee, might not have access that way. We did feel that UVU and their international student support was an agency to start with because they have some responsibility for having this person here. And we're just familiar with things at USU, but not at UVU. Also, like you were saying, Heather, the Brazilian club at UVU. So there's some informal things that may be accessible through a community of Brazilians that are here, expats that are here, that are also students, local school district support. Just, it seems like there's not a really straightforward good in, but it feels like maybe between a couple of conversations with a couple of different folks, that there might be a way to braid some resources and maybe even needing to go the informal route on some of that versus the formal route. So we put together a list of links and things in our notes that we'll send, but I don't know if Rebecca or anybody else wants to add to that. Gina was really helpful out of Pocatello. She had some good ideas.
Yeah, it's mostly just looking at kind of where we're at. We're in Idaho and Logan and Utah County area, looking at that. So student affairs based things as well as just community action centers maybe.
Right. Thank you, guys. Sometimes I love what you say, JC, about the formal versus informal route, because I can almost guarantee somebody else in some community, whether it's the Brazilian community or the UVU community, has been in a similar situation. Sometimes those informal connections are the ones that really make things work, because they know what works and what doesn't work, so you don't have to go through the whole rigmarole every time to be able to get answers. So thank you. Jen, you're last up. Bring us home with a rousing group of suggestions.
Well, our question was tough because it was, how can the father work? Which legally we could not come up with a good suggestion for that. We did feel like, the mom leaning potentially on the university that she was a student at, and going to student services kind of as a couple, and hoping that they might help start that process of navigating. May that be, does he go to an embassy here, of his country, to see if they can help or give suggestions, realizing they probably have very low amounts of trust of really anybody coming in with their situation. Clubs, programs for international students. So there was a lot of kind of leaning on the university to get the mom, working, even though most likely it wouldn't be enough to support a family. And then we just talked about 211 was brought up, and the United Way as potential resources, and maybe getting food bank help and that type of thing to kind of fill in the pieces.
Right. Thanks, Jen. I appreciate all the suggestions today. It's interesting as I think back on Dr. Crandall's presentation about the ACs and the PCEs and that, the short term, we've got to take care of it, the rent and the stress that's going on right now. But you think about that long term and what can the family do to gain some of those resources to make sure that this young kid has as many PCEs as possible, right, through his growing up years. And so with the stress of the rent and the stress of everything else that's going on, those are all those ACE things. So, as I thought about it, thinking about what could the family do, what kind of resources would there be to help ensure that that child had some positive childhood experience as well, to offset all of kind of the things that came naturally with them coming here and not being able to work and having rent issues and having a lot of those missing the country things. So anyways, thank you all for what you've done. The Hub team, thank you for helping facilitate those groups. Everyone who participated, we appreciate it. Remind you, March 20th is our next one, the third Wednesday in March. Encourage you to register, pre-register, and remember to take the survey. We love getting the data in and being able to justify why we do this and how we do it, and sure appreciate all those who take the time to do that. So until next time, thank you for your time.